to go ahead and start the webinar series. Good morning, colleagues. I welcome you to our global webinar series. The one for today, we will be discussing the incident management system, specifically addressing the FLANS functions. Just by way of a couple of administrative announcements, we would like for you to remember to use the question and answer location at the bottom of your screen to submit your questions for the presenter. We are monitoring the question and answer box and the chat section as well to retrieve questions and to discuss them more broadly so that everyone has a working knowledge of the answers to those questions. So feel free to make sure that you include that if you have questions, and we will do our best to answer. Additionally, I'd like to call your attention that all of the presentations, the seminars that we have will be posted on the Discord for your review. And the questions at the end of each session, we will have a small quiz that you'll be able to go in and take. So there'll be an opportunity for you to test and check out your comprehension of the content that was shared earlier. That being said, just one other thing I'd like to bring to your attention is that last week we discussed the operations section, and it was a very robust section. Dr. Wessam Manakula did a fantastic job going through operations, and these are key pillars that we are building upon in sharing and the specific details of operations, how it's designed to function, and the benefits of that. So that was really done exceptionally well last week, and we want to continue in that regard this week. This week, let me just go ahead and get to our moderator. I'm the moderator, Chuck Minchon from US CDC. I think I'm probably no stranger to most of you, but it's my privilege to serve as moderator today. I've been very adept and averse at working in the global community and sharing and building capacity there from the platform of the US CDC. Our presenter this morning is Dr. Osman Imalha from WHO Emerald region, the Eastern Mediterranean region, and he in particularly leads the technical support for the countries in Emerald, serve as incident management support team lead for COVID-19. He's also providing technical support to countries and review the COVID-19 response plans and their operational readiness. He's providing He's also engaging in pre-hospital and hospital readiness for COVID-19 response. So he's also part of the Emerald Country support team. And I look forward to him sharing and explaining the plans function of it. Our panelist this morning is Ariel Adrian Han, and she'll be also working and pulling together the questions to share with us, and Sanait Fakadu. She'll be available as well too. So those are our two panelists this morning, and we look forward to a robust time in going through our webinar. And with that said, and no further ado, make welcome for Osman. He's going to kick it off at this point in time. Osman, the floor is yours. Osman, are you talking?
Sorry, I was muted. Sorry. Good morning, good afternoon. Do you hear me now?
I got you loud and clear.
Yeah, thank you so much. Good morning. Good afternoon and good evening for everybody that is connecting from different time zone. And thank you so much, Chuck, for the introduction. And as Chuck mentioned that we continue discussing the incident management system series. And last week we discussed the operation function, which was a very robust discussion. And today we're expecting also to have similar discussion regarding the plant section, the plant function as part of the EIMS. And for today's presentation, we're going to go through starting from the pre-emergency, discussing how plan evolved and how it established, going through to the process of developing the response plan or planning during the emergency itself. So I'm going to walk you through the if I may start. It is why it is not clicking. How can I move that? Yes. So the outline of presentation today, we're going to start discussing the planning process from the preparedness phase and walk you through up to the response phase. The second one is going to discuss a little bit about what the differences between developmental plan in general versus response plan. What are the differences between the two terms and between the two concepts of those plans? And also we're going to have a touch base of the types of response plan and the layers that the response plan is being developed and accumulated through the planning process. And last, we're going to the plan section, you would like to be the functions, what will be the term of reference, responsibility with subject within the planning section. So as I said, that planning starts in the preparedness phase. And as you know that the preparedness is a process for developing and implementing emergency preparedness, follows an iterative cycle. And by iterative cycle, it means that when you end up after doing, at the end of the cycle, that doing the evaluation correction, you need to step in a higher position to be in a better place. Okay, now we have more understanding, we have more knowledge, we have more resources, so we need to be in a better position. So it's not a vicious cycle. You need to build on your experience, build in your lesson learned, build on your gain knowledge to be in a better position to have more answer for more questions that face during your responses. So it is a very iterative cycle. It spans from prevention, preparedness, response, recovery, and reconstitution. So for today's presentation, we're going to focus on the planning phase. So it started with assessing the risk and capabilities. Then you do the planning, then implement and evaluate. And as I mentioned, that this should be like informed by the lesson learned. So the next time we start the assessment, it's going to be have more understanding for that. So if we have more focus on the planning part of it, that if we look for, this is just arbitrary graph, that if you look for Minister of Health or whatever emergency response program or the department within your ministry, that we do have a longitudinal along the time that the disaster management plan. It has many definitions. It has many terminology, as I mentioned. That some people name it like National Action Plan for Public Health Security. Some people call it National Action Plan. Some call it Strategic Plan. Whatever the name is, it doesn't make you confused. It is a plan that define, okay, what are the capacity need to be built over time in order to be in a better position. This is what we said that. So over time, you're building your capacity. So this is the developmental plan, the strategic plan, the action plan that you invest more resources to build your capacity to be in a better position for responding to emergency. But unfortunately, emergency will not stop and will not wait for you till you develop your capacity and then it will hit. It will hit anytime. So during the line that you're developing your capacity, emergency will hit you. So what shall you do during this time? So this is what is meant for response plan, how you organize your capacities and you organize your knowledge and resources in order to better respond to this emergency. This is the response plan. So this is the differences between these two dimensions. The developmental strategic action long-term plan, this is along the horizontal line of the time, but the response plan is vertical. If you can see that it has a vertical dimension that you respond now to this emergency, how you organize, how you put your resources together to respond to this emergency. And this is a very distinct clarification in the concept. We need to make sure that it is well understood. So the Public Health EOC framework in 2015 defined the National Emergency Response Plan, which is called ERP, and sometimes it's called All Hazard Response Plan, or sometimes called Response Plan or Preparedness Response Plan. Terminology is still used interchangeably, but that's all heading towards the same concept. It's a document that describes how an agency or organization will manage its response to emergency of various types. And this is very important. It's not going to be for only single hazard. It's going to be for almost all hazard by providing a description of the objectives, and you describe the policies and the concept of operation of these responses to emergency, and the structure and the authority and responsibility for a systematic, coordinated, effective response. In this context, emergency plans are agency or jurisdiction specific and detail the resources that you have on hand for this specific agency or jurisdiction, what are the capacity and capabilities you do have, and that the agency can organize or mobilize to respond to emergency. Also referred
Osman,
to as,
excuse
yep.
me, just very briefly, Osman, there was some participants who say that you're speaking very fast. Maybe you can take a bit more time and go through it a little bit more slowly for those who struggle following.
Okay.
Sorry. Thank you very much.
Thank you. So it's also referred to as an emergency operation plan. So what I'm trying here to say that this is the document that describes how the organization responds, how it will utilize its resources and coordinate these resources and defining how stakeholders could be engaged, how we mobilize all these resources in order to respond better to this emergency. And I want to reiterate again that it has different meanings, some different terminology. So in different documents, you will find different terminology. So don't get confused with those terminologies. At the end of the day, they all are describing the same approach for that. So the National Health Emergency Response Plan, which is ERP, it has 3 layers of developing. The first one, it's called the All Hazard Response Plan, which define the cross-cutting issues. During response to emergency, we do have cross-cutting issues. We do have coordination. We do have information management. We do have human resources issues. These issues are irrespective of the hazard that you are responding to. You do have some question you need to answer. So all these are gathered together in what's called the All Hazard Response Plan, and which is actually, these numbers are just arbitrary. This is answer most of the question you need to answer during a response. It is almost, we can say it represents almost 80% of the questions you need to answer to response. How you coordinate, what will be the line of command, how can you report, how do you activate your response? These kind of questions, all of these could be answered in the All Hazard Response Plan. Then annexed to this plan, you need to have a specific plan or hazard specific plan, sometimes called contingency plan. And this is a hazard specific. It answered the issues related to floods, which is different from cholera, which is different from mass casualty, which is different from cyclone. So this hazard has their own specificities and their own questions that need to be answered for them. So based on what is being discussed in the All Hazard, now you're being annexed with these hazard specific plans in order to complete the picture. And by doing so, you are answering almost 95% of the questions. So this is show that during peacetime, people are asking what EOC will do. During peacetime, there is a lot of work to be done during peacetime. This is one of the issues that you need to develop your plans, you need to test it, you need to train people on those plans, and you need to make sure that they are functioning. And both of these plans are developed during preparedness. Only incident action plans are done after response. So this is the response line. Only incident action plan was done, which only answered like about 5%. This is just answering where to mobilize resources, how many resources you need to mobilize, how many people you need to send, how many supplies you need to send, these kind of questions that is answered in the action plan. So this is just to give you the sense of, okay, during preparedness, we have a lot of work to do. All the plans should be prepared before response. And you need to make sure that you have answered all these questions in a very collaborative way. So this is just a schematic representation for what I'm discussing, that we do have multiple hazards, hazard A, hazard B, and hazard C. This is just example. You do your risk profiling, you find out those are the hazards. These are just examples. These are the hazards at the national level that may need your intervention. So then you develop your emergency response plan to make sure that it covers all these hazards. So what will happen? I need to have an incident manager. I need to have incident management system. I need to have resources. I need to have so and so and so. So these answers should be, these questions should be answered in this response plan. And then, as I mentioned that for hazard A, we need to develop contingency plan for hazard A. If its flood happens, what will be the scenarios for this flood, and how could we respond to that flood? What will be the resources required to respond to that flood, and so on and so forth. For hazard B, the same, it has its own specificity. So this is specificity, and these questions are answered hazard contingency plan B or hazard specific of that one. Some hazard may not get to the attention that we need to develop a contingency plan for that. So it has a very minimum impact. It could be done at the subnational level. So you don't need to include a separate hazard specific plan for that one at the national level, maybe dealt at the subnational level. It depends on the capacity. So this is just example of how you organize. You define all your hazard, you develop response plan for everything, how you coordinate everything, and then you have a specific question for hazard that's being answered in the hazard specific plan. All this process is done during preparedness, and I tell you this is very robust intervention or measures. You need to have stakeholders being involved. It's a long process to develop that. It takes sometimes months or sometimes years to develop this, and it is a living document. You need to update them whenever it is finished. Either you do simulation exercise to test them to make sure that they're valid, or even you test them during real-time event if it happens. So you do after action review to inform how these plans are valid or answering the question. I don't want to go into the details of that one, but this is just a framework how the whole hazard response plan, the cross-cutting, the overarching plan looks like. What are the answer? What are the headings that it tries to answer? It started with the context. We need to define the context, the country information, the health system organization, the public health risk profile. All these need to be there in order to build your all hazard response plan. And then you go a little bit deeper in the health emergency resources. What resources you do have? What plans, what policies, what frameworks you do have? What is the coordination mechanism? What are the human resources and how you mobilize them? What information body you do have? What are the physical resources? These kind of resources you'll be using during response. So this is will need to be mapped and answered. Then you go to the next level, which is the response activation. How we activate our response. We need to have a disease surveillance. We need to have early warning system. We need to have event-based surveillance. We need to have whatever kind of information to tell us, okay, now we're having event, now we're having incident, now we're having a problem. So this system need to be, and we need to identify how we collect this information in order to get, okay, this is something serious, we need to respond to that one. So this is need to be well articulated. The alert, the verification, and the risk assessment, all these questions need to be answered. How we get the alert, how we verify whatever information we get, how we send, how we conduct a risk assessment, and this kind of question. And the most important part also to how we activate our response plan. What will be our activation protocol? What are the levels? 1, 2, 3, 1, 2, 4, whatever. It depends on the context. What will be the levels and how you move from one level to another level? What will be the criteria? What will be your critical information requirement? What will be the essential alert information you need to have in place in order to help you deciding what are the level of activation and if you are moving up or down in the scale of activation. Then based on the activation, you need to start your response. And by this one, you need first to have the concept of operation. Usually you do have 3 levels of interaction, that the strategic level and the operational and tactical level, which is being discussed in the previous session, but how this relate and interact. And then what will be the incident management system look like? What will be the functions, as we discussed, it's going to be a modular, but we need to be predefined in our plans. Okay, what will be the term of reference for each function? What will be the roles? What will be the responsibilities? Who will be responding to this area, and need to be trained on these jobs before they respond to emergency. So after finishing the response, it also need to answer how we are deactivating and how we're going to be doing post-response activities like the emergency phase out, or demobilization, and then after action review. All these questions need to be answered somewhere, and this after action review will feed back again in the resources, and then okay, this is the lesson learned, and now we need to update this and that and to make some sort of a correction. And also sometimes people add the recovery part of it, especially the early recovery. Sometimes people say, okay, we need to have a separate plan for recovery. It is both way can work, but you need to make sure that there is somewhere some document answering how we transition from response to recovery, especially if it is a very long process. Annex to this plan, as you see at the bottom, there will be hazard-specific contingency plan for priorities. So this plan answered the general questions, but the specific question answered in the annex, and this is will be a hazard-specific plan annex. It depends on your risk profile for each priority risk. You need to develop a high contingency or hazard-specific planning. What would be the enabling step to develop emergency response plan? You need to have obtain a political commitment, because this document has some sort of a legal implication. You need to have some sort of a political commitment because it has cross-cutting or intersection of authority between other departments, maybe even outside the Ministry of Health. So this, unless you have this political commitment, it's not going to be fly over and be implemented. You need to have strategic risk assessment to identify what are the risk profile of the country and how you can approach that. You need to have also like a capacity assessment, like joint external evaluation is one of the examples. You need to see what are the capacities, real capacity on the ground in order to build your plan based on that one. And then also an inventory of existing plans, regulation to make sure that they are all aligned and there is no cross-cutting issues or no conflicting between documents. So you need to make sure that you did inventory for all policies, framework, plans, regulations, not only for the health sector, but also for other sectors, to make sure that there are synergy between those documents and they're not conflicting with each other. So as I mentioned, it is a very robust process. It needs a lot of investment in terms of time and capacities to develop those plans. And then it's a teamwork process. It's not a single man process. So we need to have a stakeholder being involved into that one. And then the process is developing like a workshop to achieve a common understanding and define the objectives and outlines, and then the roadmap for developing of that one. Usually it needs, like, as I mentioned, like months to develop. Sometimes it depends on the complexity of the situation on your country. It may take more than that. You need to make sure that it is validated. By validated, that means that it went through a simulation process or testing to make sure that it is valid. Whatever you wrote in the document is valid. And it is shared, and that this is the very important part, that the plan should be shared, and all stakeholders involved in the response, they should have copy of that, and they should be not only copy, they should be trained into how to do the job if the response happens. So this is very important part. It's not only to have the document and make sure that it's a living document. People are trained about that plan. Then annexed to that, as I mentioned, that there are the hazard specific or contingency plan, and WHO published a guide regarding that. It has 6 elements. I'm not going to go into the details, but in that one, you need to define the scope of intervention. So it is a flood. The flood is going to affect in this area, and this will be the description, blah, 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 blah. So it is a cyclone. It's going to be affecting that area. It's going to be that big, whatever description of that one. And then based on that, you develop your mitigation strategy. So for this hazard, what would be the mitigation strategy? Is going to be different from other hazards. So it has hazard specificity into that one. And specifically for that hazard, what would be the alert verification and response activation? What would be the threshold to activate? If this hazard crossed this threshold, now we're going to activate the response. So it's specifically defined a national level threshold or critical information requirement to respond to that hazard if it crossed that threshold, and how we're going to activate the response. Also gonna presentation of the operation response, how will operation response look like, what will be the strategies to respond, what will be the coordination mechanism for that. And based on the 4 bullets, then you can identify what will be the required capacities and resources to respond. So for this hazard, I need this amount of money, I need this amount of human resources, I need this amount of lab testing, whatever. So you can quantify, and you can first identify and then quantify what will be the capacities and resources required in order to respond to that one. And it is scenario-based planning. So you build one scenario or different scenario, it depends on your understanding of the situation. And then you develop those scenarios. Based on those scenarios, you develop your proposed contingency response or hazard specific response based on that scenario. The 6th element is that making sure that these plans are tested and maintained. And this is making sure that it is not just written in paper. These are real things that could be implemented on the ground, and this can be tested and validated several times. For the incident, this is all that I mentioned should be developed, tested, maintained, validated, trained during preparedness. So all this happened before emergency. When emergency happens, we develop what's called incident action plan. I'm not going to go into the details because we already discussed. We had a dedicated session. You can refer to it into the Discord that we have a dedicated session for incident action plan. It defines all the component and the response for the incident action plan. So this is the only part that you develop it after the incident happens. So this is just to show you how things related into that area. Then after we're done with the planning process and how we develop it through the process from preparedness to response, now we have a look at the plan section within the EOC, within the IMS. how does it look like and what would be its function. So from the discussion we had several times, this is just an example how the incident management with the 5 essential functions: the incident management, operation, the plan, logistics and finance. And in the last week we discussed operation. Now we're going to discuss the plan. I will just give you an example of what will be the responsibilities for the plan section and what will be the subunits within that function. So generally, the plan section is responsible for analysis, planning, training, and evaluation of the whole response. The plan section collect and process, analyze, and evaluate information in order to predict the evolution of the emergency. So it helps you to say, okay, where are we heading? Based on the information, it collects this information and try to analyze it and try to come up with synthesized knowledge to say, okay, we are going to that direction. This is going to be escalating. This is going to be fading out. This is going to be spreading, whatever direction that is going to happen. It also identified strategies and objectives for addressing emergency. What will be our strategies and objectives to combat this emergency? So it tried to come up with a possible or the most useful strategies or objectives to addressing that. And this is going to be done jointly with operation and other department. I will come to that into the next slide, but this is one of their tasks. It's also responsible for prepare and disseminate the status report and document incident response activities. One of the action is to make sure that it maintain that, making sure that everybody in the response are aware of the situation and updated with the involvement of the response and the involvement of the event itself. It prepare and distribute plans because the plan will have a different version, depends on the operational period you have. You will have like incident action plan version 1, version 2. It depends on the cycles that you are going to go through for your response. So it's not going to be only single plan. It's going to be updated. So it is the responsibility of the plan section to ensure that all people are informed about the new updates, or if there is any strategy that's being implemented now. For example, now for the COVID, now we are introducing the vaccination as intervention. So this is update whatever need to be communicated with others. And also it is responsible for conduct and evaluate of exercise and response. So it is part of its responsibility to evaluate the response at the end. And also if there is some sort of exercise to test the functionality of our plan. As I mentioned, there are shared responsibilities. It's not going to be a standalone for the plan section, but these responsibilities are done in a very collaborative way. So during a public health response, responsibility for information management is shared between plan section and operation section. This should be governed by standard operating procedure in order to develop the objective to respond and to maintain the situation and awareness. And one example is that operations collect the data of various activities, like for example, surveillance or laboratory, and it is analyzed and integrated by the plan section. So this is just to show this is the activities mentioned in the previous slide is done collaboratively with other units within the IMS. So it's not going to be standalone. So developing the objective is going to be proposed by the operation section and then amalgamated and gathered by the plan section to put it in one plan and make sure it is distributed to everybody. This is just an example of how the plan section could look like. These are the possible units that or subunits that could be there. And I need to say that this is just an example. It depends on the magnitude of your response mechanism or response operation. Could be only few people doing all this job. But if it is a very massive response, you need to divide them into subunits. It depends on the span of control as being discussed. So the bigger the response, the more units and more specialized units that you need to have within that one. So generally, we're talking about 5 main functions that within the plan section. The first one is a situation unit. The second one is a subject matter expert, the documentation unit, the resource unit, and demobilization. We're going to go into brief about describing what would be the roles and responsibility for each subunits in the couple of slides. So the situation unit is the main unit that is responsible for collecting, processing, and organizing ongoing situation information. So this is the unit that updating the people about the response and the event progression and how is it going and how we are responding. It also preparing situation summaries. So and whatever the periodicity, will be the responsibility to prepare that situation summaries. preparing graphical and numerical projection and displays of incident information. What will be our expectation that this is going to be going up, this is going to be spreading widely geographically, this is going to be ending in the coming 2 days or whatever. So whatever predictions or anticipation, this is going to be part of their job. Also projecting, as I mentioned, and forecasting for the event, how we expect that to be evolved, preparing maps, gathering and disseminating information and intelligence for incident action plan, preparing for and participating in meetings, and providing up-to-date situational awareness and making sure that everybody is aware about the updates and informed about the progression and the involvement of the event. So pretty much they are the tower people that are guiding the response, and they say, okay, we are heading this way, or no, we need to head that way, and giving the people, making sure that everybody is aware about the situation and where we are heading to. There is another point that it's the subject matter expert, and during an incident, subject matter experts are called upon based on need. So you don't need every time you have them. It depends on the situation. If it is, for example, this is chemical event and we don't have much experience in the team for people with chemical events, so we can call for a subject matter expert in chemical event to support us in the technicality and the issue that need to be implemented to control that specific event. So this depends on the need and depends on the the situation of that one. These personnel have a special skill and they actively involved in this should be part of their job. So this should be like, as I mentioned, chemical expert, he should be like having some sort of expertise. An example like epidemiologist, forensic pathologist, pharmacist, whatever. It depends on the situation. We need to have different subject matter expert to support the decision making and to make sure that we do have a sound, technically sound decision process. The third one is the documentation unit. And this is very important because it is usually overlooked or missed, that we are very, sometimes, I don't say every time, but sometimes we are very weak in documenting our situation. So each incident in itself, it's a learning opportunity for us to learn from it and to see how we can improve our response better. So unless we do document this event very well, we will not be able to review it when it ends, and then we say, okay, what we did, what we went well, what we went wrong, and how we can improve ourselves. So this is the importance of documentation. It maintains accurate, complete, up-to-date incident files. It ensures each section maintain and provide appropriate document for post-incident documentation process. And then combining and reproducing the incident action plan, in order, as I mentioned, that there will be a series of incident action plan. This is the job to keep record of all these incident action plan, to see our progression along the line. Okay, how we progress. We started with this objective, then we moved to that objective. If you want to go and look back, okay, how we did in the back and how we can correct, then this will be the job to guide us. Okay, this is the document we can easily see and check our back steps. The fourth unit is the resource unit, and the resource unit is responsible for ordering and tracking the delivery of incident-related resources based on the request from the operations section and sometimes from others unit. They will be responsible for ordering and tracking what will be the stages. So when they're doing the update, we requested cholera kits. Now it is in this pipeline in coordination with the logistics and finance also regarding that one. Coordination with other unit for care for and maintaining, arriving, staging, and employment of mutual aid resources. So if you are receiving any resources from outside, this will be the job also to try to stage these resources and to say, okay, how we can make better use of these resources and how we can fit these resources in our response mechanism. The last unit is the demobilization. So after we are ending, or we are de-escalating, or we are scaling down our operation, we need to have to do this in a very structured way. So we do have a demobilization unit, which is responsible for collecting, evaluating, and disseminating information regarding all incident resources, developing and disseminating demobilization plan, how we are going to retrieve resources being deployed to the field, how we're going to retrieve them, how we're going to bring them, are we going to leave them at the field to build the capacity for future, or we're going to bring them at a national level for whatever. So all these kind of issues and these kind of questions need to be answered by the demobilization plan. And also monitoring demobilization process and progress, how we are going to, and how we are we are scaling down our operation and coordinate implementation of demobilization plan into that one. So this is will be how we de-escalate and how we deactivate our response. Our response is going to be facilitated by the demobilization unit. So in a nutshell, that the plan section responsibility during response, it has assume the following responsibility: aggregate and process data. And by saying aggregating and process data, we are talking about three main data: the event data itself, either being the case number, epidemiological situation, whatever, and then the response data, how we are doing during our response, what will be our indicator to measure our response data, how many people deployed, how many ambulances being deployed, drugs, money, whatever. And also the contextual data. What is the context? What will be the requirement in the country, the security issues, if there is any, the geographical area, land or air, whatever contextual data that shape our response. This will be also their responsibility to amalgamate, to have all these three elements in order to support our incident action plan development. So we need to have a complete picture about the three dimensions to support our planning process and how we can have a very sound incident action plan. And also it is responsible for developing and communicating operation information. It makes sure that everybody is very aware about his job and about the update, and also predicting and the probable evolution, as mentioned before. It is also developing objective, as also stated in the previous. So I'm just reiterating or recapitulating what we discussed in that one. It also identify what are the required technical expertise to respond to that emergency. So as a recapitulation for our today discussion, that we started with discussing the concept of horizontal versus vertical dimension of planning. We said that there are disaster management plans that addressing the questions regarding how we build our capacity over time. Like this could be strategic plans, national action plan for public health security, action plan, whatever the name is. These are the plans that is governed by time. Okay, over this 1 year, 2 year, 5 years, what will be our plan to develop our capacity? These are what's called the disaster management plan, or we do have many names. What we are talking here today is about the response plan, which are the trying to answer what are the actions need to be done, what are the resources need to mobilize today to respond to this emergency that is happening today. So this has a very vertical dimension that, okay, what will we do to respond to that emergency? So these issues need to be well articulated. We discussed also that emergency response plan has 3 layers, or three types. The first one is all hazard, that is answering what are the cross-cutting issues regarding coordination, concept of operation, information management, line of command, incident management system, whatever. This would be irrespective of the hazard that we're facing, is going to be the same answer. Then this should be annexed by what is called the hazard-specific contingency plan, which tackle the specificity for each hazard, that has their own specificity. What would be the threshold for activation if it is flood, or what would be the threshold if it is humanitarian crisis. So this will be a little bit different. And both of these need to be developed, as I mentioned, in the preparedness, and this is a very long process. Then after that, if an emergency happens, then we develop an incident action plan. In itself, the template should be ready before, during emergency. People should be trained how to use it, but we will just fill it with the details of, okay, an incident in the capital is going to be different from an incident in the rural, even if it is the same incident. So the magnitude will be different. So here we need 5 ambulances, here we need 50 ambulances, here we need 2 medical doctors, here we need 20 medical. So these kind of answers, the quantification and identification of specific needs is going to be answered in the incident action plan. So this is just to give you a more wider picture about the planning process and how it links with the preparedness, and need to make sure that during peacetime, we do have a lot of work to do preparing these documents. The blast section, as described, it's structured into maybe 5 units. You don't need, this is just an example, you don't need to activate all of them in all the emergencies. It depends on the magnitude of the events. So you need to make sure that all these functions are being fulfilled. So you need to have, for the plan section is providing situation awareness. The plan function is providing subject matter expert opinion or technical opinion. The plan section is documenting the event. The plan section is tracking the resources. The plan section is also taking care of demobilization and deactivation plan for phasing out or the deactivation. The last thing we discussed that the plan section manage event data, response data, and contextual data to develop the incident action plan and to guide our response. So this is just a nutshell of the a summary of the plan section and how it works and how it relates. So this is all from my side, and now the floor is back to you, Chuck. Over to you.
Thank you very much, Osman. As usual, you did a most fantastic job in covering the plan section. I specifically appreciate how you captured and shared with us the enabling steps for developing emergency response plan. I think that is also critical to have in advance and make sure those aspects are covered in the planning section. But you did a fantastic job with that, and for that we are grateful and thankful. Just with no further delay, let's go and get into some of the questions that were placed and asked. And I think just one in particular is, it says, can you use one contingency plan for two separate hazards which have similar characteristics and features? That was one of the questions that popped up there.
Okay, this is a very good question that, and I think you're now getting the point that, okay, contingency plan or hazard specific plan, and then is it separate? That means it's a separate in nature, that is need a separate different plan. But if it is the same nature, for example, if you are looking for two outbreaks, which are two vector-borne diseases. So they do have similarity in the etiology and the way we respond. So we can have one contingency plan for vector-borne diseases covering for this, maybe for the Rift Valley fever and also for malaria, because both are vector-borne diseases. So we can gather them into one contingency plan and add specificity for each one. And as I mentioned that each contingency plan, it has many scenarios that should be developed. It's not only one scenario, it is scenario based. So you can have multiple scenario for single hazard, and then you can have multiple scenario for different hazard if they are have same etiology and same response mechanism. So you have scenario A if this outbreak happened in that area, scenario B if that outbreaks happen in that magnitude in that area, scenario B if you have a concurrent outbreak of that. So this will be the type of diversity you can have within the contingency plan. So the answer question is yes, it depends on the etiology and the response mechanism if they are aligned. Over.
Thank you very much for that answer, Osman. Arian, you have a question you want to put forth before the audience here. Over to you.
Yes, thank you. So thank you, Osman, for a very good presentation on an interesting topic. We have a lot of questions. I'm not sure we'll be able to answer to all of them. Before bringing up the next question, I would just like to mention that as the example, I am in Germany. For us, it was very important to have this emergency response plan. And I think that is what in the beginning of the pandemic gave us a head start and gave us a good, at least initial response. Of course, at the time, we didn't know that this was last over a year. And of course, now we are, as everyone else, also struggling. So yeah, as I said, a number of very good questions. The one I would like to raise next is for the interagency plan. Somebody asked for interagency plans, it is better to focus on the effects or inputs for the coordination, which I think is an interesting one. Thank you.
Yes, absolutely. This is very interesting. And I think I implicitly mentioned that, but let's explicitly discuss that. What we are discussing here, it is the health sector response plan. And this is not going to be standalone in silos. This is need to be based on a national, more wider, bigger plan at the national level. Usually if the country, they do have National Disaster Management Authority or Civil Defense Authority that's taking care of all in response to national event, our health sector plan should be part of that one. It is, we usually define it as like an umbrella, and each section is a sector plan. So we have a sector of health sector, we have the security sector, we have the education sector, we have the infrastructure sector. These response plan need to be developed together under the umbrella of the national response plan. So definitely you need to make sure that these plans are developed in joint coordination and collaboration with the higher official or authority and also answered the question of coordination, lateral coordination with other sector, how we coordinate with animal sector, how we coordinate with veterinary, how we coordinate with security, how we coordinate. Well, these sectors need to be answered into that question. So over to you.
Thank you very much for your response, Osman. Another question that was come up that I wanted to put out before the audience too is, the question was, what is the specific role of the demobilization unit? Could you expound on that, please?
Yeah, usually when we end our de-escalate or deactivate our response, we need to do this in very structured way. And the demobilization unit is the unit responsible for looking after how we de-escalate and how we deactivate our response. So we need to have a plan how we're gonna, for example, you deployed resources for the field, how we're gonna retrieve that? Are we gonna leave them for the subnational level to build the capacity for future response, or are we gonna own it? If we borrow some resources from other stakeholders, how we can demobilize? So how we are going to de-escalate, it's gonna involve like human resources and other supplies and logistics, and then these issues, how we're gonna structurally demobilize our de-escalate our event, our response without and looking for the progression of the event, making sure that we are de-escalating and we are not just missing the event. So making sure that we are following the slope of the event. Now we're controlling everything. We need to move from level 3 to level 2. We need to move from level 2 to level 1, and then what kind of resources need to be retrieved, what kind of human resources need to be retrieved, what kind of operation need to be down escalated. So this will be the unit looking after about that one. Over to you.
Thank you. Adrian, over to you for the next question, please.
Okay, thank you. So this is about the incident action plan, and you mentioned that this one is developed and coordinated by the planning session, and the question is who should take part in its development, and also what support should the strategic level provide in order to ensure that the development and implementation of this plan goes well? Okay.
This is very interesting, and I think, as I mentioned, we already have a dedicated session for that. I also refer people to in the Discord. You can check for that one. But let's answer this question here. Our incident action plan development is the responsibility of incident manager. So he is the person who is responsible for making sure that it is developed and it is implemented. And it is developed in coordination. We do have what's called the planning meeting at the beginning of the event. So we gather operations section, planning section, all the sections to, okay, agree this is the situation, and this will be our objective to respond in this operational period, and this will be our strategies to respond. So based on the discussion in that meeting, the planning section will write all the inputs, will collect all inputs from for people, and then put it into plan, and this plan will be raised to incident manager to approve it and to make it functional. So this is a process. It's going to be the discussion based with all the team, and then the plan section will be responsible for gathering it and producing it in one plan template, and there is templates that you can also refer to it in that presentation, and this template should be approved by the incident manager. And this is going to be the first one, but repeatedly it's going to be continuous process, depends on the operation cycle that you're working on. At the end of each operation cycle, you issue another updated incident action plan version. Over to you.
Thank you, Osman. One other question that came up that I think is interesting, it says, some of the roles you described under the planning section also looks like operations, like the situational unit. Can you, I think what they're looking for is, can you describe or differentiate how the situation unit roles differ from those in operations, if there are, or is there some overlap between the two? Over.
Yeah, definitely. As I mentioned in one of the slides, that there is one of those responsibilities are shared responsibilities. So it's not only the plan section that's going to do that. It's based on the operation section, also give them information, but also other section, maybe planning, maybe admin and finance, maybe logistics. Also, it will inform the plan section to develop this situation awareness. Okay, because it's not only update about what we are doing about in the response, but also what will be the resources available, what we are planning to do. So this situation awareness, to complete the picture, they need to coordinate with all these units. So it is collaborative process, but at the end of the day, they will issue this situation awareness, and they will govern the periodicity of that one. And definitely this need to be approved by the incident manager to approve the situation report and the periodicity of this report. But they will be the people who collecting the information and producing it into a very comprehensive way. Over to you.
Okay, thank you, thank you, thank you. Ariane.
Yes, let me have a look. So we have a few more questions. There's a question, for example, where a participant asks whether one can use the contingency plan for two different or separate hazards that have characteristic features in the context of all hazards. So basically you talked about the specific ones and less specific plans, but maybe you can still talk a bit more about how you can interuse potential specific hazard plans.
I think we answered this in the first one, but okay, as I mentioned that this contingency hazard, it depends on the risk profiling that you're developing. So from the risk profiling, you identify what are the priority risks that you're expecting. So for this country, our priority is going to be flood, Rift Valley fever, conflict, and road traffic accident. So whatever, this will be our priority. So if you identify this your priority, for each priority risk, you need to have hazard specific plan. So what will you do if this happens? So if the flood happens, there will be like one scenario, or it depends on your countries, there will be like 5 scenarios if that happens. So you develop your response based on that scenario. And this is just also trying to be ready. The main essence, okay, we need to gain the time. If the incident happened, we have the answer for many of the questions that we think. So we need to think of all the possible questions that or scenarios that could happen and how we could respond to that one. So sometimes you need to, we find yourself, we do have 2 hazards related to each other, usually happen as a consequence for each other. So we need to consider them in one, like the flood and its related diseases. So we can consider it into one hazard. And then you try to answer specifically. The flood will happen, then we expect acute watery diarrhea, then we expect casualties and drownings, and we expect these kind of hazard. So based on that scenario, what will be our response? We need to have treatment for acute watery diarrhea. We need to have mass casualty for people being whatever accident will happen, and we need to have so on and so forth. So it depends on how you define your risk profile. Yes, definitely the answer, you can put together hazard with similarity in the etiology and the response together in one contingency or one hazard specific plan. Over to you.
Thank you, Osman. And what I'd like to also share and add is something he mentioned briefly, was that this, when you look at contingency plans, they're based on a comprehensive risk assessment that's done in advance. So you have some idea based on your geographical locations and the environment and what some of your historical data may show. You have an opportunity to target specific events and hazards according to how prevalent they may be in your specific area. And because you've done that and you've done an analysis of the specific risks that are germane to your area, you're more prone to be able to pivot from one to the other. For example, if you were working with avian influenza, and all of a sudden you you built your contingency plan around avian influenza, but in another respect, you didn't have avian influenza occur, you were dealing with swine flu, for example. So to pivot and leverage some of the similar characteristics, you would still be within the frame or scope to a certain degree of being able to apply a lot of those protocols. So that's a way of being able to leverage contingency plan and being able to pivot and using similar plans to help mitigate an immediate threat as the need may arise. Hopefully we answered your question there. We just have a few more minutes. Osman, you've done a fantastic job with the presentation and addressing a lot of the questions here. Adrian, do we have one more question by way of wrapping up and as a last option? Over.
I think, yes, I would like to convey first a comment, and that is the importance of the differentiation between the emergency response plan being drafted during the preparedness phase and the incident action plan during the response phase. So there's different mission objectives, and they will both be updated either during the event or afterwards and after the evaluation. So it's very important that we do our evaluations there. There was another participant who shared the difficulties of the political commitment, saying that everyone seems to give the impression that the political commitment is easy to obtain, which is of course not the case often during an emergency. So not so much as a question, but as a challenge, you know, whether there's a political willingness, whether there's the necessary memorandums of understanding with the ministry and so on. Then in terms of questions, there's one more question that I would maybe check. There's a question that I'm not completely sure. It relates to COVID-19 and how to put this or to contextualize this with COVID-19, because of course this pandemic, more than maybe some others, has an effect on so many different areas. It has an effect on health, economy, social, education, and so on. So I don't know if you would like to say some final words, Osman, about this, really applying it even more to the ongoing pandemic we are all facing right now.
Yeah, I think this is very very relevant, because when we are doing risk assessment, supporting countries to develop this risk assessment and go through the profile, is one of the elements that, or one of the risks that we're asking people about the pandemic. And luckily that it is being addressed as at the top priority in almost many of the countries, that we should be prepared if pandemic happen. So based on that, what will be your intervention? What will be your resources needed? I know that is going to be a very resource intensive, and it is very strong operation to respond, and it involves many sectors that outside the health sectors. So during the developing the contingency plan, everybody should be involved. Okay, what will be the roles and responsibility for all the sectors? And this kind of plan need to also to have the buy-in from the higher officials. If you have National Disaster Management Authority or whatever the national level you do have, they need to be involved in developing such plan, because when you are developing your contingency plan, also you define what will be the relevant stakeholder that should be involved. So that one need to be like having a buy-in. But unfortunately, many of the country, I don't want to say that they don't succeeded very much in selling the idea for the higher official. Okay, we need to invest that amount of resources and that amount of investment to prepare for something. Politicians usually they don't think that it is very imminent, or it's going to be giving them a buy-in or a very winning political win. So this is going to be a lot of struggle. You ask them for a much of investment, but usually they don't see the outcome of it. But now, having witnessed or having lived this experience, I think we are in a better position in the health sector to sell our idea very much, and to give them a live proof that, okay, because you're not listening, you're not investing very much in responding to such emergency, we are expecting that. We've been hammering over and over, saying that a pandemic, it happened, it is guaranteed. It is not the question what, it's a question about when. So now it happens, we need to be a little to learn from this lesson. And as I showed in that graph of the all hazard plan, we should have after action review and even maybe interaction review to get the lesson learned, what we learned from this experience. Each event should be a learning experience for us to build back better and to make sure that we are improving our plans in the future. So this is a very life experience we lived in our life. We need to make sure that, okay, if this is not going to be the end, this is just one, maybe we're expecting to see it in our life, maybe in coming future also another one. So how we can learn from that experience and build upon that one. So this is over to my side. If Chuck or you have anything to add to that, over to you.
Thank you very much, Osman. And yeah, just one little small comment I would like to add, is especially regarding the political engagement and support. One of the things we realize that this is definitely a challenge, but what I would like to offer in the preparedness phase, when you're really building your relationships and building out the process here, is to engage your upper leadership as often as feasible to gain their oversight, insights, and blessings, if you will, on the work that is being done there as a value-added component to the health sector, showing them what this incident management system can do for them to bring rapid intervention at the least smallest amount of time, so that you have the least impact to the normal day-to-day operations of a country or a region or a village or city. So we want to be not only building our capacity, but building our capacity with a lot of involvement with the senior level executives and staff, knowing that what you're doing is going to pay them big dividends going forward. And the COVID-19 is one particular global pandemic where we can see the need for investment in public health emergency operations centers, and the public health emergency management program at large is a key determinant of how things pan out long term. Of course, there are more variables involved in that than what I just described, but in general, I'm speaking from a general platform perspective more broadly. Colleagues, you have come, we have shared, we've had a very wonderful and interesting discussion on the planning section. What I want to just leave you with right now is we're going to continue. We have logistics and finance that's going to be coming up. We have communications that we're going to be talking about going forward. And we're going to spend some time drilling down in details on all of these. And so I would highly welcome that if you would go out, talk to your colleagues, let them know about the wonderful work we're doing with the webinars, and encourage them all to participate. Yes, I'm aware that we have other opportunities and things that are going on as well, but dedicate a certain portion of your time to participate in these webinars. They are beneficial to all, and I think this helps lift the response level and the competency level at large in an easy to work from platform. So we're doing this for your benefit, I'd like to emphasize, and I really want to thank you for sharing and being a part of the webinar today. Ari, you have any last minute comments?
No, that was a perfect closure. Thank you, Chuck.
Okay, Osman.
Thank you so much. Thank you so much for your nice words. Thank you.
Okay, Wami, are you have anything to share?
No, we look forward to having everyone next week. Thanks, Chuck. Thanks, Ariane, Osman, and all panelists. It's been a great time. Thank you, everyone.
Okay, and with that, we are going to consider the webinar a wrap. Enjoy your day or evening or night, wherever you may be. Until next week, be safe.
Thank you. Bye-bye.
Bye.
Bye-bye. Bye.